Good morning, everybody. It's such an honor to see you having plugged in. My name is Caroline Wadege. I'll be your moderator for the day. And welcome to Gifted Gems. Before we start, the main theme for the day, we'd like to start with a word of prayer. And I would like to invite Evelyn to begin with a word of prayer for us. Karibuni nyote. Evelyn, please begin for us with a word of prayer.
Let's pray. Our Heavenly Father, the Son, and the Holy Spirit, Father, we come before you this particular morning. Father, we are asking you to guide us, to start with us, as we are going to start our webinar about autism awareness in children. Father, we welcome your presence, we welcome your strength. Father, let us start with you. I cover each and every person in this webinar with your blood, mighty Father. Father, I pray for our doctor, I pray for all I pray for all our participants and our moderator, mighty Father. Have the way in each and every person, mighty Father. Father, we pray that you are going to release your wisdom, your understanding, Father, for what you are going to learn for this day. Mighty Father, I'm praying you cover our network, cover our network, cover each and every person with your precious blood. Father, as you do that, we glorify your name. We thank you, Jehovah. I pray that and I believe in Jesus' name. Amen.
Amen. Thank you, Evelyn. Once again, we'd like to welcome every last one of you to this meeting where we want to learn more on autism. We are creating awareness on autism in children, the causes, the symptoms, the diagnosis. Through the year, we'll be doing more of this. So this is just the first of our autism awareness engagement. So we invite you to plug in even the rest of the coming webinars. So I'd like to start off starting with Caroline, our caregiver. Caroline, good morning.
Good morning. How are you?
Fine, thank you. Thank you for joining us.
Thank you for having me. I'm grateful.
Karibu. I can see also Dr. Lilian Kerubo is with us. Good morning, Daktari.
Morning.
Karibu sana.
Asante.
Okay, so Caroline, we'd like, first of all, we thank you for agreeing to share your story with us. I'm sure it will enlighten most of us. It could be the first time for some of us to hear about autism. It could also be maybe a caregiver who's on this journey, but all in all, there's peer-to-peer learning. So Caroline Karibu, maybe you can tell us a little bit about your story, when you discovered your son had autism, probably what signs did you see? And then we'll pick it up from there. Karibu.
Okay, thank you, Carol, for inviting me to this program. I'm grateful to be here. I am Carol, and I'm a mother of three. And my son, Carl, is my second born. I gave birth to him in 2016, and everything was fine. My pregnancy and birth, I can't recall anything that went wrong. But when I was 5 months to 6 months pregnant, I was admitted to the hospital and I was put on medication. I had threatened abortion. But when I gave birth to Carl, it was so seamless, very fast. And I started my journey in raising my amazing boy. So at around the age of 1.5, he had acquired all the milestones. He was doing well. He could read. He could recite the alphabet. He knew the numbers. He had even reached a level where he could form numbers using matchsticks or toothpicks. But all of a sudden, his speech disappeared. And all I could remember is that he was continuously crying, to a point where neighbors used to ask the watchman to come and investigate what we are doing to the child. But he would cry for even 2-3 hours continuously, and we didn't know what to do. So we went to many hospitals, and because at that time his speech had not completely disappeared, it was very hard for us to even think of autism. We had never even heard of autism before that. So I took him to the hospital because he had a fever, and I took him to get fruits. And the pediatrician who saw us, is the one who started noticing some signs. And then she asked me if I've ever done any test on him. So she asked some questions, and I can say I went home a very disturbed parent, because I could sense from our conversation that I knew that that my son had some issues that we needed to really look into. But I went into denial almost immediately. And anything that I could comfort myself with to just tell me that my son, he's called Carl, doesn't have any special needs. I just used to cling onto whatever thing that would comfort me that my son was okay. And so I wasted a lot of time in denial. But the more I didn't do anything, the worse he became. So I went to get fruits to do some tests, and we started our journey there. And that's when I knew for sure he had autism. But I faced some challenges during the test because they required a hearing test. And at that time, you could not put anything in his ears, and they required that test to be done when he's quiet. And one thing about my son is he can never be quiet, especially when you're putting things into maybe his ear or yeah. So I faced that challenge with testing, but so I didn't complete his testing because they required that. So then I went home, and it was now a whole journey of wasting time that I could have used for early intervention. Yeah.
Thank you, Caroline. That is indeed a very moving story, and I'm sure caregivers who are here with us can relate with some of what you've said. You know, one thing you've mentioned, Carol, is that when you went to Gertrude's, you asked some questions. Maybe you can give us one or two just to bring us to speed with what the questions were like and how that felt for you.
Okay. She asked me if I told the pediatrician that Carl used to continuously cry, have tantrums. So the pediatrician asked me, does he have repeated behavior? And Carl used to have repeated behaviors. She asked me, does he have it? I told her he had speech, but he has lost it. And then he asked me of hyperactivity, which was very evident because even staying with him in the hospital was such a struggle. He was hyperactive because I had not started him on a diet. I used to give him juice, very sugary drinks, because that's what he used to like. It was very difficult feeding him, and he was a very picky eater. So the doctor asked me such questions, which after I went home and researched, it was very easy to tell that he was on the spectrum from the symptoms that the doctor explained. Yeah, thank you, Carol.
Asante sana. Yeah, indeed, those questions that you were asked, are shedding more light to us who are here today on some of the things to expect. I know Daktari will get into that much later, but even for a caregiver who's listening, it is good you've brought that up. I also like what you've said about the being in denial. Actually, that's one of the things that caregivers really struggle with, because I believe we all want a journey that is smooth without hitches and all that. And once you get such a diagnosis, I being also a caregiver, I know it takes a toll. It takes a toll. So how did you work on overcoming the denial phase to now? What helped you in that phase to overcome so that you can seek help?
Honestly, it took me a while, and looking back, it was purely God. I know now for some people saying it was purely God looks cliche, but for me, it's God. It was such a hard moment because nobody else understood the journey that I was going through with Carl. I used to stay with him the whole day and whole night, and he used to cry continuously. And even going with him to church was such a struggle. And one day and there was a neighbor of mine who had a child who had similar characteristics. And I noticed that we had shifted from where we used to live, but now I remembered that lady had a child with similar characteristics. He never had speech, he was hyper. So I called the lady and she explained, she just told me of her journey of that the son had autism and what she's doing, and a lot of research. I went to, I think Google was my friend. I went to Google a lot, and I now started doing diets on him. So when I started the diets, now it got a little bit better because the hyperactivity was contained to some extent. So I could say it's purely God, and then I started research on my own. Yeah.
Thank you, Carol. I am picking at least two things that you have said there about diet. Maybe you can tell us a little bit more on what worked for you or what is working for you so that a caregiver can also hear. And then also, just maybe to reiterate, I like what you're saying on research, because as a caregiver, this is one thing that we advocate and always request that it be close to us. Research, because information is power and it helps you make an informed decision. So you can tell us a little bit about, the diet. What are you using? What is working for you?
Okay, so the first thing I started was gluten-free, casein-free, and sugar-free diet. Starting him on a diet was hard because I could say that day in, day out, those are the things he used to eat and enjoy. He loved bread, he loved chapatis, he loved juice. I remember for us to go to church, I used to buy juice. So I immediately started on gluten-free and dairy-free and sugar-free. So for sugar, I used supplements like, I supplemented sugar. If I'm baking a gluten-free cake for him, I'll use bananas, I'll use honey, I'll use dates. And I found very amazing flours that you can use to just supplement. There are flours that you can even make chapatis with. And recently, I've now started weaning him off from cooking oil. So I'm using olive oil. and I've given him supplements, fish oil, and I'm also and I'm doing vitamin B12. Yeah, and a prebiotic to help with his gut health.
Thank you, Carol. I'll just ask one more question because it's a question that I've encountered very many times on the diet, and especially the flours. Which flours, for instance, do you use?
I found a flour in Chandarana. It's called an all-purpose flour, which has I think what makes that flour different is it has water chestnut flour. So it's very light, and you can and it's just like wheat flour. So that is what I found that worked, because cassava flours, they have very funny taste. So for me, I worked on that. If I want chapatis or mandazis. For cakes, you have a lot of options. You can do wimbi, you can do, it's called amaranth. They are very good with cakes. So for cakes, you have a lot of options. But what has worked for me with chapatis is a certain flour. It's written in Hindi and it's found only in Chandarana. And it's about 165 shillings for half a kilogram, which is cheaper than most of what is offered.
Okay, thank you so much, Carol. I'm sure we have learned something where, one, we can get some of these products like that flour that you talked about. I know there's also one called Ferrari flour. It's also in Hindi.
Yeah, it's that one. It's the one you, yeah.
Ferrari. Okay.
Yeah, I've
Yes,
forgotten
yes.
the name.
Yeah, there's that we can use as well. Chandarana and Health U also stocks. So thank you, Carol, so much for that. One last question, or when the news was broken to you, how was it broken to you? Was it in a packaged way or iliachiliwa tu?
That was the main struggle, because when I went to get roots, I think that the clinic I had gone to, where I had gone to see a pediatrician concerning his flu and fever, was very good, and she knew how to package the information. But when she sent me to their main branch in it is in what is that place? I have forgotten, but I remember. The specialist I found was not accommodating, and one thing she told me is, I'm the one to help my child. And even to add on that, the tests that they required I do before they give me a diagnosis, I told them it was impossible. And they told me that Carl should not sleep, so that the next day he's going to be able to do that test. And I kept him awake for the whole night. And the next day he was awake. He couldn't sleep. So I ended up not doing that test. And that is what delayed my journey, because she told me I'm the one to help my child, and I didn't have the information on what to do to help my child. So I think that to some extent delayed my journey and put me into denial. Yeah, thank you.
Thank you, Caroline. Yes, that is a test that's commonly parents, of caregivers of children with autism. It is one of the tests that more often than not we are asked to do. Dr. will help us with the terminologies, the name. I seem to forget it, but yes, there are tips to that. As a caregiver who's with us, maybe can write in the chat what you did, what worked for you if you've done that test before, to help keep that child awake, so that by the time you go for the test, the child is awake throughout. We can learn from each other. You could chat, you could write in the chat what worked for you. So why I asked about how the news was broken, Caroline, is because I know how the news is broken to a caregiver determines their next step at that point. And that is why I asked about that. I know for some caregivers, it's been hard, but in others, it's been easy. So thanks for sharing that. Now, as we wind up on the questions, Carol, what tip can you give to a caregiver who's just found out, whose child has just been diagnosed with autism so far? Your child is how old for the purposes of our caregivers?
He's 6 years old.
Okay. So please share some tips that a parent can pick up.
Okay, so one thing, if your child has just been diagnosed or you're coming to terms with that your child has autism, one thing that really helped is knowing that I'm a steward to that child. He doesn't belong ultimately to me. God has just given me a responsibility to bring up that child. And I need to rely on God to bring that child up. Yes, there are going to be many challenges, but if you rely on He who gave you that child, He will lead you through in every circumstance. Another thing is get information. We are living in a time where there's a lot of information on YouTube, but also sieve that information. Look, just see what could work for you and leave out what will not work for you. Don't just go into trends that people tell you this is working, this is working. Understand how your child is, and also be very patient with yourself and that child. Like diet, they're not going to just embrace it, but consistency is key. And also get creative. Sometimes I think we are used to breakfast has to be chai na mkate. And I can say, like, for now, even don't use the Ferrari flour, because Carl has adjusted. I bake bananas and he'll take that for breakfast. He'll take peanuts, then the nuts for breakfast. He'll just take ginger water as tea. So with time, it's going to get easy, but have patience for both yourself and your son. And also, if there are other children involved, have don't don't leave them and just focus on that child. Give them their time. I neglected my daughter during that time, and it's something now I'm really struggling to adjust to. So bring them along. Know that the kid is different, but every person in your family needs you. Yeah, thank you.
Thank you so much, Carol. You have put it so well. I can only summarize your words in three. One, patience for yourself and the child. Two, research and sieve the information. And three, balance as much as you can across all the children in the family. So, Carol, we are very grateful for opening up and sharing with us. I know that there are caregivers who have learned something. We all have. And so, asante sana.
Thank you. Thanks for having me.
Karibu. Now we want to go to our next step, where we are going to invite Daktari. Daktari Lilian Kerubo is with us. She's a pediatrician. Yes, you can see her. Daktari, karibu once again. I'm going to give the floor to you to just introduce yourself, tell us more about yourself, and then just get right into it. Karibu sana, Daktari.
Asante. So thank you for this opportunity, and thank you for Carol for giving us a very enlightening talk. It was also a learning experience for me as a doctor. So my name is Lilian Kerubo. I'm a mother, an African woman, and a pediatrician. And from there, I live a life of service. So I serve everywhere where I can find myself, but mostly where children are concerned. So be it in the hospital, at home, in school, or anywhere else that I find myself. So thank you for this opportunity. And I'd like to start with the presentation. Okay. Thank you. So that's just basically what I've talked about, who I am. We can go to the second slide. So today we are going to talk about autism, and majority of us are here because we've either heard about autism, or we have a child who has been diagnosed with autism, or we know somebody whose child has been diagnosed with autism. And I'm glad that we are having so many, well, not so many, but autism is becoming quite a topic that is being discussed, and awareness is being created, because there needs to be a lot of awareness. Once we have awareness, then we can have acceptance. And once we have acceptance, then children or adults who are diagnosed with autism will feel part of life and will not feel ostracized, because it will become almost like a regular thing to have a child who is in the spectrum, so that they don't feel like they are not human beings, or that they are less than other people. So autism comprises a group of disruptive neurodevelopmental and behavioral disorders. So neurodevelopmental just basically means the development of the brain. Neuro is just another word for brain. So in autism, we find that the brain development is different. We try not to use the words delayed or abnormal when we are describing children or people living with autism. They are just different because their brain develops. However, it develops in a different style than what we are used to. And most of the symptoms are seen in their communication and in their behavior. And we have different levels of people who are in the autism spectrum. We have those in level 1, who are what previously used to be called as high functioning, because they may have a lot of the typical findings as other children. They may be speaking, their intelligence may be normal, they may be in school, they may actually, it may actually be very difficult for you to pick out and say this child is autistic, and they require very minimal support. As opposed to a level 3 person or child who may require a lot of assistance, may require to be with an assistant perhaps 24 hours a day. They may require special learning accommodation, and some of them are actually have actually functioned better in an institution as opposed to being at home. So we have different levels of people in the spectrum, and that's why it's called a spectrum, because no one child is the same as another. Even when you get 2 children who both have autism, their functioning and their adaptabilities are very different, even though they have the same diagnosis. And that's important to remember, because one of the mistakes we make is to compare children, either children who are in the spectrum or comparing children who are in the spectrum to children who are not in the spectrum. And that will lead you into a lot of challenges once comparison starts. So as I've mentioned, deficits will be seen in speech, social, emotional, cognitive, and behavioral aspects. So there are those who will have challenges in speech, there are those who will have more challenges in their social relationships, there are those who will have more challenges in their emotional adaptability, there are those who will have more challenges in their understanding and intelligence, and there are those who will have more challenges in their behaviors. So every child is different, and all children will not come to you in the one manner. So there, if you wait for children to just not have speech for you to say there's autism, then you will miss a lot of autism children. If you just wait for children who have emotional challenges for you to diagnose autism, then you will have missed a lot of them. Or if you just wait for those children who have behavioral challenges for you to say this child might be autistic, then you will miss a lot of them. Autism is more commonly observed in boys compared to girls. This may be because of the social expectations that are in boys as opposed to the social expectations that are in girls. because most people tend to be okay with a girl who is not talking, or a girl who is shy, or a girl who is reserved. But when a boy is not talking and a boy is not is reserved, people are alarmed. They're like, hey, kwani huyu mwanaume he's a softie or something. So I don't know if that is why we are diagnosing more boys than girls, or is it true, really true, that more boys have autism compared to girls? That's something we need to research and get an autism is usually passed down from in generation. Usually when a child is diagnosed as autistic and you're taking the family history, you will realize that you may find an uncle or a grandparent or a sister or an aunt who has also been diagnosed, or maybe not diagnosed, but people were found some symptoms in this uncle or auntie when they 4 years old. If you ask the grandparents, they will say, one of my sons has always been a loner, never wanted to talk to people, but maybe that son had not been diagnosed. But now, because there's a third generation child who is being diagnosed with autism, that's when that information comes out, that there was an uncle or an auntie or somebody who had delayed speech, or who preferred to stay by themselves, or who had behavioral challenges. So it always, that's information that always comes to us in retrospect. And so it is important to realize that majority of the children who are autistic probably inherited a gene or some of the history from their genealogy. We yet do not understand what causes autism, although I know there are regulations, there are many theories on what causes autism, but the initial position, we do not know what causes autism. Autism usually starts from birth. However, the symptoms may manifest much later on. You will find that most children will be diagnosed between the ages of 1 and 5. And that's because during those ages, a lot is expected from a child. It is expected that the child will speak. It is expected that the child will play with their friends. It is expected that the child will somehow go to school and, follow the order in school. So when a particular child is not following that trajectory, that's when somebody's like, okay, could there be something wrong? However, again, when they come to hospital and in retrospect, the mothers will start saying, well, even from birth, this child did not seem to have interest in me. Even as I was breastfeeding them, they didn't seem to smile back. When I was smiling at them, they didn't seem to, interested in the surroundings. So this is a child who has been autistic from birth, but the symptoms only manifested themselves when the social expectations on this child exceeded the social adaptations that this child had developed by that time. Next slide, please. So I'd like first to discuss what people in the spectrum are able to do. Sometimes as doctors or as healthcare workers, we like immediately going into the inabilities or the challenges that a disease presents before we even talk about the unique abilities and the unique gifts that people with a particular challenge may have. So it's important to know that children who are on the spectrum are not helpless, and they are not totally dependent on others. There are things that they can do. And of course, it varies from child to child. Every child has unique abilities and every child has unique strengths. Children in the spectrum are not stupid, and they are not intellectually disabled, as contrary to what is popular. So some people make the mistake of thinking that children in the spectrum do not understand anything. But actually, children in the spectrum may actually show even higher intelligence than regular people. Their learning style may be different. They may need to be taught in a different style. They learn mostly by modeling. So they learn about the world around them, usually by observing and modeling what they have seen, as opposed to memorizing and cramming and basically repeating what has been taught to them. But if they see something, they are very observant and they have very good memory, and they may actually reproduce the information that they learned from observing more than the information they learned perhaps from reading or staying in class. So sometimes the learning style may need to be changed, but it does not mean that they are not able to understand or that they're not able to comprehend. Children in the spectrum are very adaptable. As I've mentioned, they learn mostly by observing, remembering, and then reproducing the information that they have acquired. So they easily adapt to the situations that they find themselves in. They can be trained, so they are not trainable. They are not untrainable. They are trainable. They have a heightened sense of smell, texture, and sound, and this is very beneficial because in case a fire has started somewhere, the first person who will realize that there's a fire might be that autistic child, because they'll be able to smell. They'll be able to have that sense of smell and smell that something is burning. They are also able to perform all the tasks that other people can perform, but perhaps they may need some accommodation. So it's important to know that even as you raise children, sometimes you have one child who is in the spectrum and the rest of the children are not. Sometimes you find parents giving lighter duties to the child who is in the spectrum because the assumption is that the child in the spectrum cannot do regular duties, but that's not true. They are fully functional in their motor skills, their muscles, their joints are working fine. So if your other children are washing socks, the child in the spectrum should also be able to wash socks. Perhaps they may need some reminders or some accommodations. Maybe if they are sensitive to water, they may need gloves, but it does not mean they cannot wash socks. If your other children are able to wash dishes, the autistic child should be able to also wash dishes. If your other children are able to maybe take their dishes to the sink, the autistic child should also be able to do the same. So they are able to do all tasks just like any other person out there. And even in the workforce, we are working with autistic people. Perhaps they have not been diagnosed, but we are able to pick out some autistic adults, and they have been functioning just fine with some adoptions and accommodations. They're also ambulant and dexterous, which means they can use their hands, they can use their fingers, they can use their feet, unless they have another disability on top of autism. But autism does not limit a person's hands or feet or, from doing, let's say, exercises or riding a bike or walking or writing or anything that may be required of their hands and their feet. They also have a great appreciation for art, music, and repeated physical activities. I know sometimes the fact that they love repeated physical activities seems like an impediment, but it can sometimes be a strength. There are some jobs or some talents that require that repetition. For example, if you want to be a pianist, you have to repeat the same note several times. You have to strike the same key several times. And that's one area where an autistic person may excel, where instead of another person who might find it boring, an autistic person might find such an activity excelling. And it's not a surprise that most of the talented musicians are actually perhaps autistic because of that need repetition, that need for fixation, that need for focus. I don't know who needs to mute. Is it Ruth who needs to mute? Okay, next slide as we wait for Ruth to mute. Caroline, are you able to, is it Caroline or somebody? There's some interference in the sound. Okay. So what are some of the signs that children in the spectrum or people in the spectrum may have? Important to know that physically you are not able to distinguish between a child in the spectrum versus a child who is not in the spectrum. There's nothing physically obvious. It's not like a disease like hydrocephalus or this other disease called achondroplasia. where you can physically see somebody and immediately know that is somebody with a particular disease. There's nothing usually physically unique about children in the spectrum. They just look the same as other children. However, in some cases, children in the spectrum may have a slightly bigger head compared to their peers. We usually take a head circumference, and sometimes when you compare the head circumference of children in the spectrum versus their age mates, you may find that the children in the spectrum may have a slightly bigger head. Some of them may have, because of other diseases that they have, because there are some diseases that when you have such a particular disease, you end up also having autism because of that disease. So there are some diseases that are associated with autism. Some of these diseases include things like Asperger's syndrome or Fragile X syndrome or Angelman disease. So the disease already has physically distinguishing features, and then now because of that disease, this person ends up developing autism also. But the main point I want us to leave the room with is that you cannot see an autistic person and just say that person is autistic. There's nothing physically distinguishing or physically unique for you to say this person has autism and this one does not. Next slide. So one of the major finding, or one of the hallmark features of children in the spectrum is they may have deficits in communication. And communication, is good to remember that communication is not just verbal. We also have non-verbal communication. Sometimes you don't, I remember this joke that people love making, that when you were growing up and your mother was angry at you, she didn't need to tell you that she was angry at you. She would just give you a look, and you knew that your mother is angry and that you needed to stop whatever it is you are doing. Now, that may not be a cue that an autistic person will pick up. So it's important to know that communication may not just be verbal, but it will also be non-verbal. So when we are diagnosing or when we are trying to assess children with autism, we don't just look at the fact that they are not able to speak. How are they able to pick up some non-verbal gestures? Are they able to give back some non-verbal communication? So when it comes to speech, most children in the spectrum, their mothers or their fathers will report that this child either did not babble or babbled very late. Babbling is basically what children do. In Kiswahili, we say kuendesha gari. There's a sound children make between the ages of 4 to 6 months that sounds like the engine of a car. And that's usually one of the early features that shows that this child is starting to develop the ability to speak. Children in the spectrum will either be late to babble or they may not babble. Most children will speak their first word between the ages of 8 to 12 months. Children in the spectrum may either delay or they may not produce their first word in this at this time limit. And then sometimes children in the spectrum may have a limited vocabulary. This is one thing that brings a challenge with diagnosis, even with the caregiver who shared with us, Carol. This was one of the challenges when it comes to diagnosis, because her child was speaking. And so it's usually very hard to diagnose autism in a child who is already speaking, because people have this misconception that autistic people do not speak, which is a lie. Sometimes you find an autistic person who is speaking, has a lot of words, can produce speech from their own heads. We call it spontaneous speech. However, some children in the spectrum, although they are speaking, the number of words they are speaking is limited compared to their age. So for example, we usually use a random mathematic that says a child between the ages of 1 to 5 should be able to make a sentence that has the number of words consistent with their age. So for example, a child who is 2 years should make a sentence of 2 words. So a child who's 2 years should, for example, be able to say something like Mami kuja, or mom milk, or dad go, because he's 2 years and that sentence has 2 words. But you find an autistic child might be 2 years, but they can say mom. but cannot add another word to it. So they may not be able to construct a sentence. So it's not just about the ability to speak, it's also about the number of words that this child has in store in their brain. I've already talked about the sentence and phrase construction. Then some of these may have speech, but their speech is in form of repeated words and repeated consonants. So you may find a child is speaking, however, they keep saying the same word over and over again, and sometimes that word is unnecessary. So you may find a child saying, mommy, enda. They're repeating that word, enda. And sometimes that enda is not necessary in whatever it is that this child is trying to communicate. And that just goes back to that point of limited vocabulary. So they're trying to communicate something, but perhaps they don't have the vocabulary for whatever it is they're trying to communicate. Some of them keep repeating consonants. So they might say, when my child was a few years old, we were trying to say a word that had one syllable, la. So it just has that la once, but she would say that la like 10 times. So she would say, I don't remember what that word was, but let's say it's something like elephant. So instead of saying elephant, she would say elephant. So she would repeat that syllable le several times. And sometimes we see this in autistic children. And then sometimes they repeat instructions and questions. So you'll find a child, you tell them, go bring a cup. And then they repeat that instruction, go bring a cup. And they may repeat it several times. Perhaps maybe they're trying to understand it, or they're trying to remember what those words mean. So they keep repeating what it is that they have had somebody else say. And sometimes when you ask them a question, they may not answer the question, but they may repeat the question you have asked them. Like you may ask them, what is your name? And they say, what is your name? You ask them, where is mom? And they repeat, where is mom? You ask them, where are you? And they repeat, where are you? And that's something we call in medical terms echolalia. Some children may have a high-pitched question-like intonation. So they may speak, yes, but again, I remember this joke that people make about the community that I come from. I'm a Kisi, so people usually like saying that we like speaking in soprano and we like having a very high intonation. I don't know how true that is. Sometimes you may find that children in the spectrum or people in the spectrum, they're speaking things that are making sense. They're logical and they're coherent. However, the tone and the pitch and the, like there was a way you phrase a statement so that somebody knows you're asking a question. You may find somebody says, where are you going? The going has a higher pitch so that somebody gets the point that you're asking a question. But you may find somebody in the spectrum maybe wants to speak a sentence, but the tone they're using and the pitch they're using is like they're asking a question. So those are some of the variations that we see with people who are in the spectrum. So it's important to remember, what I want us to remember from this slide is that absence of speech does not mean somebody is autistic. And presence of speech also does not mean that somebody is not autistic. That is the point I want us to come out with from this slide. Next slide. Socially, the people who are in the spectrum also show some social challenges that require assistance. For small children, they may have delayed pointing. The skill to point is usually acquired at 9 months. And so at 9 months, a child should be able to point at something. Either it's something they want or it's something that is interesting to them. They should be able to point at around between 8 and 9 months. Children in the spectrum usually show a delay in pointing. And why this is important, pointing is an indication that either you can ask for help, even though you don't have the speech to ask for help, or you can share what is interesting to you with other people. And this is a skill that children should have so that later on as they are growing, they learn the social requirement of asking for help or the social requirement of sharing your joy or sharing your interests with others. So when a child is showing delay in pointing and delay in sharing what it is that interests them, we are concerned. Some of them have delayed or absent eye contact. Eye contact is something children have from the age of 1 month. You'll notice that when you're breastfeeding a baby, they usually, for mothers here who have breastfed, when you're breastfeeding a baby, you'll find that the child usually opens their eyes and looks at your eyes. They usually have eye contact. With children in the spectrum, that ability may not be there, or if it's there, it's for a very short period of time. You may find a child looking at you for just a brief second and then looks away. Some parents actually come to the clinic thinking that their child is deaf, because they complain and they say, when I call my child, they don't respond, they don't turn, they don't look around. And sometimes people may assume or may mistake this child for being deaf, yet they are just autistic. Then some autistic people look like they are not with you. I don't know how to explain that. Sometimes you may be in a room with somebody who is in the spectrum, but their mind or their behavior communicates that they are in a different place or that they're in a different world. And this is a common finding with people who are in the spectrum. They look like they're in their own world. Most children who are in the spectrum also do not like to be touched and do not respond well to strangers. Typically, children have something we call stranger anxiety from the age of 6 months to 1.5 years, which means that if the stranger picks them up, they will cry. Or if a stranger comes to the room, they will cry just because they're afraid, because they don't know this person. However, in a child who is in the spectrum, this stranger anxiety may go for long, even beyond 1.5 months, 1.5 years. When they are 2 years, 3 years, 4 years, they still don't want to be near people that they don't know. And if somebody who they don't know comes close to them, they may have a meltdown, or they may become very irritated. Some children in the spectrum also show minimal interest in toys, in peers, or in play. It's common for children to be excited about toys, about playing with their friends, about going outside. But sometimes you find some children who prefer to be by themselves and who prefer to play with very few toys. It's always a red truck and nothing else, or it's always a red ball and nothing else, or it's always a red dress and nothing else. They don't want to try out new toys. They don't want to try out making friends. They don't want to go outside to play. And so they prefer to be alone, and they have difficulty keeping friends and relationships. And this is not just in children, it's also in young adults and teenagers. Because sometimes, as I said, some autistic people are in level 1, which means their functioning is basically just like any other person out there. And so many children are not diagnosed at childhood, but when they reach teenage years, you find that they are loners, they just prefer to be by themselves. And when they are young adults, you find that they don't want to have friends. They basically just prefer to be by themselves. And this has led to people, very many people, adult people, being diagnosed with autism when they are in their adult ages, when they are in their teenage ages, which is unfortunate, because the earlier the intervention is started, the better the person accommodates, and the lower the rates of depression or mental illness in people who may be autistic. In class, teachers may report that this is a child who does not participate, or who does not participate fully. Maybe they're doing a round song. This is a child who might decide to sit down in their desk and not participate in those games like Ring Around the Roses, where they hold hands and go round and round. This is a child who perhaps may not prefer to do that. Next slide, please. And then their behavior is one thing that causes a lot of consternation and surprises. Children or people in the spectrum like to do a lot of repeated movements, repeated plays, and repeated activities. So they may do a lot of the same thing over and over and over and over again. So for example, you may find a child who likes spinning around the room. So they'll just keep spinning and spinning and spinning and spinning. There are children who like maybe flapping their hands, so they'll just keep flapping and flapping and flapping. There are children who like producing a particular sound, so they may, if it may be shrieking, so they may just keep doing it. Yeah. Some may produce like a gargling kind of sound that comes from their deep throat. They just keep doing that over and over again. Some may be interested in a particular book, and they will only go to that book, nothing else. That's the only book they will want to read. And if somebody takes that book, they will have a meltdown. Some of them may be fixated with a particular activity. It may be the sound of running water. So you'll find this child always running to the tap, opening the tap and having that tap drip, and that sound of water slashing and that sound that water makes may be the one that keeps them going to the tap all the time. There's a child I saw who liked the texture of soil. So they would just find soil anywhere and just play with that soil and just have that soil rub his hands, because that seems to be something very interesting to him. So whatever activity they like or they are fixated on, they will want to do it over and over and over again, no matter how many times you try and stop it, no matter how many times you try and intervene. And we usually tell parents, if that behavior is not harming anybody, if it's not harming the child, if it's not harming the other people, then we should just let them go on, because it has been shown that these repeated movements are very calming for them, and it helps them to center them. So if it's not something harmful, if it's not something dangerous, we should just let them have it. If it's dangerous or wasteful, like if somebody likes the sound of running water, of course, if they have the tap on all day, it can be quite expensive to pay that water bill. So you can find a way of maybe recycling that water. You can buy for them a small fountain that recycles that water and keeps them with that same sound that they would like to have. Some of them show restricted interest when it comes to food, places to go, what to watch, and music to listen to. So we take it for granted that you'll just buy a child some food and they will eat it, or that you will just wake up and say, we are going to church and all children will want to go to church, or that you can just turn on a TV and whatever is showing, that the child will just like it. But children in the spectrum may show very restricted interest. They may eat only one particular food, and they may only want to go to, they may just want to stay in the house. Maybe they'll not want to go to the mall, because maybe being in the mall with all those people and all those sounds and all those lights can easily irritate them. Maybe they only want to watch one channel. If it's Cocomelon, it is just Cocomelon, nothing else. Don't put anything else. So those are some of the things we see with their behavior. And when this, what they're interested in or what they are fixed on is not given to them, or is changed, they usually have a tantrum and a meltdown, which is not easy to calm, just like what Carol said about the crying that would continue for hours and hours. These children prefer short, repeated acts. So instead of giving them something that takes so long to finish, just give them short, repeated acts. So you can tell them, just stack up these toys one on top of the other and keep repeating. Instead of telling them, go tidy up. After you tidy up, go fold your clothes. After you fold your clothes, go wash dishes. After you wash dishes, go do this. That may overwhelm them. But if you give them a short task, they are able to do it. These children sometimes elope or wander, which just means to run away. Some children can present as a danger, because some can run away and go into a road and they may be hit by a moving vehicle. Some of them can run away and be met with dangerous people. Maybe they'll be met by robbers, or God forbid, rapists and child molesters. So this is actually something that is quite dangerous with children in the spectrum. There's a time a child was brought to the hospital because he had wandered away and fallen into a dam. So almost drowned. The child almost drowned, but the mom, because the mom knew that her son has this tendency to run away, she knew where the likely place that this child would have run away to. So luckily she found the child in time, but the child had already swallowed some of that water and was near drowning. We call it near drowning, but the child did not pass away. So these are some of the dangerous things that can come out of being in the spectrum. Children in the spectrum also take time to warm up to people. So this is a person, if especially for teenagers and young adults, in case you have a party, the autistic person will be the one in the corner looking at people studying them before they go and start talking to them. They take time to warm up and be comfortable around people. They have a lot of social anxiety. Sometimes autistic children may also be aggressive to themselves or to others. This is because they may be overwhelmed by a certain trigger. This is why it's important to understand these children and know what exactly is triggering them. Because sometimes they're triggered by something, and because they don't have the vocabulary or the skills to express what it is that is triggering them, they end up becoming aggressive to themselves or to other people. And it's important to know what exactly triggers them so that you prevent this self-harm or harm to other people. Sometimes they may be destructive to property, especially when, again, they're triggered and if they have not been given the skills or the tools to cope with their triggers. Next slide. When it comes to the emotional well-being of these children, it's sometimes they have anger or emotional outbursts, again, because of something that has triggered them. Typically, when children are triggered, either they will cry or they will move away from whatever is triggering them and find something else to do. This is a big challenge for children in the spectrum. Either they are not able to remove themselves from whatever is triggering them, or they're not able to somehow forget or replace whatever is triggering them with another thing. And you may take it for granted that if somebody is irritated, they just move away or they just leave whatever is irritating them. For people in the spectrum, they are not able to do that, or they don't know that they can either move away or they can substitute whatever is triggering them with something else that is calming to them or relieving to them. And so they express their annoyance or their irritation by having anger or emotional outbursts. And that's why they need to be taught, or they need to be given coping mechanisms. Otherwise, they can either harm themselves or harm others. They also express a lot of meltdowns and tantrums. And we usually advise parents that if a tantrum lasts for more than 15 minutes, and if it happens for more than 3 times a day, that is something that is concerning. All children have tantrums, especially between the ages of 1.5 to 4 years. It's common to have children to have having tantrums. Either they are hungry, or their toy has been taken, or something has bothered them. So they may cry, they may throw themselves down, they may throw their hands and feet up in the air, but it should not last for more than 15 minutes, and it should not happen more than 3 times a day. If it's doing that, then that can be a clue that this child is struggling emotionally, and they may need to be assisted. Most autistic children will show difficulty with forming attachments with other people, including their own parents and their own siblings. But once they have attached to somebody, it becomes very difficult to separate. And this is common with house helps and nannies. You'll find that most mothers of autistic children will say that they keep changing nannies. A nanny comes, another one comes, they keep cycling from nanny to nanny, house help to house help. This is because it's very difficult for an attachment to be made, especially if the child is autistic. But once the child makes an attachment with somebody, that child will always seek out that person. And if that person goes away, this child will experience a very traumatizing time trying to either forget or replace this person who this child has become attached to. It's also difficult for children in the spectrum to interpret social cues. This is the example I was giving earlier, that in our days, our mothers would just look at us and we would stop whatever it is we were doing, because we understood the kind of eyes that these mothers were giving us. But an autistic child may not be able to get that social messaging and that kind of gesturing. You may need to tell them specifically in clear terms, stop what you're doing, do this instead, or go bring me this. If you just look at an autistic child and hope for them to understand whatever message you're trying to pass without using words, it may be very difficult. Sometimes children in the spectrum also show inappropriate responses. People may be sad, but the child within the spectrum does not understand that people are sad. So you may find them laughing, or they may be crying in a happy situation. Maybe people are dancing and they're happy at a wedding, but maybe the autistic person does not, get that social environment that is going on at that particular time. So they may start crying, or they may have a hard time. Next slide. When it comes to the intelligence, I've already said that children in the spectrum may actually even have a higher intelligence than regular people. However, because we test their intelligence using tests that are not designed for autistic people. There's this common analogy that people say, if you test the intelligence of animals by subjecting them to a swimming competition, obviously the fish will win that competition. But is swimming the appropriate test of intelligence for all animals? Of course not. If you do it by assessing their flying ability, the bird will win that intelligence competition. But does it mean the other animals are less intelligent than the bird? It just means your test is not designed to cater for everybody. So measuring, that's why we say you cannot measure the intelligence of an autistic child by subjecting them to the same test that you are subjecting to a non-autistic child. The way an autistic child learns, the way they grasp things, the way they understand or memorize things is not the same way as the child who is not in the spectrum. So the intelligence tests that are used to assess a child's intelligence should take care, or should cater for the background characteristics of this child. So sometimes we who are autistic and also show some intellectual disabilities. There are those who have both autism and intellectual disabilities. Similarly, there are children who are in the spectrum, but they show very high understanding levels and very high intellectual powers. So we cannot generalize and say all autistic children will show intellectual disabilities. Neither can we also say all autistic children will show intellectual superiority. So all children are different, and they all have different intellectual abilities depending on their individual characteristics. Next slide. So this is just a picture of an autistic child with the mom. And the important thing that I wanted us to pick out from there is the face of that child. The mom looks to be having some emotional expression, which in my assessment, the mom looks sad, and she looks like she's looking at something that has grasped her attention. But if you look at the child's face, the child looks almost like impassive. You can't read that child's emotional or body language. And this is one challenge that people have with children in the spectrum. And sometimes you hear, especially grandparents or people who are not very well versed with autism, they may come and say, this child has no feelings, or this child has no, is unreadable because of the facial expression that most children in the spectrum might have. But they are able to express emotion, and they are able to reciprocate feelings. Of course, it requires somebody who is used to that child to be able to understand what they are expressing or what they are going through emotionally, even though it may not show in the face. Next slide. So what are the challenges that people in the spectrum or families who have somebody in the spectrum go through? There are a lot of family dynamics that come into play when somebody is diagnosed with autism. So initially, of course, the parents will go through the phases of grieving, and they are grieving because the child they thought they would have is not the child that they now have. And so parents should be given that room to express what it is, or to go through all the feelings that go with a diagnosis such as autism. So initially, some parents will show sadness, some parents will show anger, some parents will be in denial phase, some parents will have bargaining, the bargaining phase where they say, Especially for us as Christians, we go to God and we say, God, take away the autism. And if you take it away, I'll be a better Christian. I will pay my tithe. I will stop drinking. I will do this and do that. So it's important to understand that all families take this diagnosis differently. And I've never seen a family or a mother who has been told your child has autism and said, okay, thank you, doc. Now what do we need to do? Most of the time, once the diagnosis of autism is made and the communication is made, it's always met with a lot of challenges, which is normal and natural. And parents should be given that room to go through what it is that they need to go through before they come to a stage of acceptance. And another challenge that I've seen is that if it's a family, a two-parent home, not all parents will be on the same page. Not both parents will be on the same page at the same time. So you'll find perhaps the mother has come to the point of acceptance, but the father is still in the point of anger or the point of denial. And that brings about a lot of challenges, because you may find the mom wants to start therapy, but the dad is still in the denial phase. And of course, Africa being Africa and Kenya being Kenya, women, we have to be submissive. We have to listen to our husbands. And so sometimes you find a child who is hanging in the balance. Do we take this child for therapy? No, because the parents have not yet agreed or have not yet come to the same point of acceptance, or the same agreement that we need now to move forward with this plan, or we need to move forward with that other plan. There may also be misunderstandings, and it's not surprising sometimes when a child is diagnosed with autism or any other lifelong challenge. It's not surprising or that the parents may end up separating or divorcing. And this is because when a diagnosis is made, it brings a lot of emotional baggage and also a lot of things, things that we had hidden, or things that we had covered up, but now they are coming out because a diagnosis has been made. For example, you may find that there are some parents who will now start saying, oh, this must have come from your side of the family, or this must have come from your side of the family. In my community where I come from, of course, there's a lot of speculation and stories on witchcraft. So you will find one parent accusing the other parent, oh, your people are witches, so they must have bewitched my child. So it's a lot of things that go on when a diagnosis of is made, and this is something that brings a lot of challenges when now it comes to the help or the support that the child needs, because on top of dealing with its diagnosis, now we have to deal with the unity of the home, the unity of the marriage, the unity of the extended family, because some grandparents will move away and say, we don't know that, those are not things that happen in our family, so we disown that family, we disown that child. And so it's a big challenge that we go through as healthcare workers and families when we are trying to form that therapeutic relationship. You find that the therapeutic relationship is not coming together because there are all these other factors that are going on behind the scenes. There's always worry. Parents always have worry about their children. What will happen to my child? Can this child survive without me? Can this child live without me? Can this child go to school? Can this child go to university? Can this child get married? Can they have their own children? There's always a lot of worry and a lot of concerns from the mothers and the parents, and even from the patient themselves. When they grow up and they are now 21 and 22, they always have a lot of worry and a lot of concern about getting a job, staying in a job, making money, starting their own family. There are always those concerns. There's always a lot of stigma, especially in Africa, where knowledge and awareness on autism is not where we would like it to be. It's improving, and we have to realize that we are in a privileged society like Nairobi, and we are mostly middle class, or some of us may be upper class economically, and so we have access to a lot of information and a lot of people who out there who talk about autism. But when you go to the village and you find a child who has been born in a family with autism, and there is literally no understanding. There's literally no experience with autism. And there's a lot of stigma because they've never seen autism. They've never seen a person with autism. So there's a lot of stigma. This person may be called crazy. This person may be called cursed. This person may be called bewitched. And it's become such a hard struggle to try and educate the parents, first of all, then educate the grandparents, then educate the villagers around them so that this child can be accepted and this child can grow and thrive. And this child can also be accommodated. Sometimes you find there's a lot of judgment towards the family that has an autistic child because of the misconceptions about mental well-being. And when there's a difference in how a child behaves or in how a child acts, there are a lot of misconceptions and there are a lot of myths and stigma surrounding children with not just autism, but a child who may have ADHD, a child who may have anything that makes them different or that makes them live differently. People will always judge. People will always have thoughts. People will always have conclusions about that family, and they may not necessarily be right. And those conclusions may actually end up harming that child or putting that family in danger. Children in the spectrum also experience academic challenges because now when they go to school, a regular school, the teachers or the learning style may not be accommodative to them. CBC has gone a long way in trying to make education not just for the bright students. And I think the theory or the thought of CBC was good. Perhaps the implementation has come with challenges. But I find that the style that we used to learn, the 844, was only designed for bright children or intellectually, people who grasp things faster. But I remember in our class, we had a child who had Down syndrome. In my class, I had a child who had cerebral palsy. But I only knew that after I went to medical school and did medicine. Then I could remember that, hey, by the way, my desk mate was a Down syndrome child. And I remember I was put with that particular girl because I was, well, if I can say, I was academically gifted. And so they brought the child with Down syndrome to sit next to me, hopefully in a hope that, the child will model what I'm doing and somehow help this particular child with learning. And this is a challenge that most autistic children will have in a regular school. How accommodating is this school? Are they able to, pace their learning depending on the abilities of this child? Is one teacher enough to meet all the academic needs of all the children in that class? Does one particular child need more assistance? Do they need extra time? Do they need other teaching aids? Do they need other learning methods and other learning styles? So those are some of the challenges that children in the spectrum may have. Socially, children and adults in the spectrum will have a challenge, maybe making friends, keeping friends. Some of them may have problems in a marriage based on the characteristics that we've discussed about people in the spectrum, the challenges they have communicating, the challenges they have reading social cues. You may be upset with your partner because they are not understanding that you're going through a challenge, but are they really able to see that you're going through a challenge? Do you need to use different styles for them to understand what it is that you're going through? So you'll find most autistic adults, even if they get married, keeping that marriage becomes difficult because of those social and communicative challenges that they have inherently. Making friends, keeping friends may be difficult, especially for teenagers. And we know for teenagers, having a friend is like their number one need. When adolescents get to the age, social relationship becomes more important than parental relationship. So when a teenager is in the spectrum and they're trying to make a friend and they can't, or they're having difficulties, they end up getting depression and they end up getting a lot of social anxiety. And this is one of the things that we see with autistic children when they become teenagers and young adults. Majority of them end up suffering mentally because of the challenges that they have, because of the autism diagnosis that is now making it very difficult for them to transition into the next phase of life. Some children in the spectrum also end up having legal challenges. We've already mentioned that children in the spectrum love wandering or love eloping. They just love going And in this going, they may trespass people's properties, they may damage people's properties, and people may not take their time to understand that this is an autistic child. And they may end up getting arrested, they may end up in child enforcement, places like they're called what, remand places for children who have broken the law. They may end up in jail. A lot of the people in jail are actually there because of reasons they cannot control, or reasons that they came from their diagnosis. It's not surprising to find prisoners who have ADHD, and they probably committed a crime because they had not been given the skills to control their impulses. So maybe they ended up stealing a tomato or a chicken because they have challenges with impulse control. But there's no lawyer or there's no judge who will understand that this person stole a chicken because they have a challenge with impulse control. They will simply be sent to jail. So it's not surprising to find even autistic children in jail because they could not, they have social and communicative challenges. Maybe they were found in the wrong place at the wrong time, but because they could not express themselves, they ended up being bundled in the police car and then find themselves in a cell. And then because perhaps they have challenges communicating, they end up in jail for a crime maybe they didn't even commit. And that's one big challenge that we have especially when the children grow up and transition into teenagehood and transition into young adult stage, because now the support they had when they were children is not there. So they'll be left alone to walk around the streets. And we don't know what time in the wrong place.
Is it only me who has lost
But
Daktari?
sometimes because they're not able to. Sorry.
Doc, you're not very clear.
Okay, am I back now?
Yeah, you're not back.
Sorry, I'm using internet from my phone. So when a call comes through, I lose internet. So we're talking about their health. And we said children in the spectrum have the same immunity as their age mates. They have the same ability to fight diseases. But because of their limited expression, maybe they're not able to speak, maybe they're not able to say what exactly is hurting them or where exactly is paining them, they sometimes end up being misdiagnosed or undertreated or overtreated. It's not, sometimes when children come to the clinic, they have autism, you find that they have taken so many antibiotics in their short life, but it's not because they have required those antibiotics. It's just because maybe the doctor or the person they saw could not understand them. So they just said, since I can't understand what this child is having, let me just give antibiotics just to be safe. And so it's not, they usually end up using so many medicines that sometimes are not necessary. Next slide. So what are some of the solutions that we can offer children and families that have somebody who has autism in the family? So number one is to understand children in the spectrum and to understand more about what autism is. And I'm glad that Carol talked about the importance of research. There is so much that is still not understood and that is still not known about autism, even by us doctors and healthcare workers. There is still so much that we don't know. There is still so much that we are learning every day. So once you hear about autism and once you have, maybe you have had a child who has been diagnosed about autism, that is the time now to start researching, to start learning more and more about autism, starting more understanding about your child. When you have a child in the spectrum, don't try to box them and say, all children should be like this. Understand this particular child. What does my child like? What do they know? How do they like to learn? How do they like to be disciplined? How do they like to play? How do they express themselves? Learn about that particular child and don't try to box and say all children should smile like this. All children should talk like this. All like this. Learn this specific child. What do they like? What triggers them? What annoys them? And how best do they like to learn? It's important to understand children in the spectrum, to accept them and love them for who they are and not what they could be. One of the challenges we have as, as families or as people who may know somebody who is in the spectrum is we try to make them like all other children. And this becomes a very frustrating experience for both the mother and the child, because you're trying to force them to be like maybe other children, but this child is different, and they will never conform and they will never fit into that box that we are trying to make them fit into. So they are frustrated because they don't fit into this box that we are creating for them. And us, we are frustrated because we are trying to force them into this box and they are not fitting into that box. So accept these children for who they are and love them for who they are. The best thing we can do for any person who is autistic is to accept and love them, because that will give them freedom to be themselves, and it will delay or it will remove the possibility of them getting depression and mental illness later on in life. Because children who are in the spectrum, when they become adults and teenagers, majority of them, they end up getting depression, not because of their diagnosis, but because of how people around them treated them, especially when they are younger. Most of them, you'll find they were bullied or they were beaten because people were trying to beat out the autism from them, or they were disowned because people say they have a curse or whatever, or they were not given the same opportunities as other children because maybe we believe they are less capable. So when we accept them and love them for who they are, it gives them confidence to be themselves. It gives them confidence to learn. It gives them confidence to grow. And you'll find them excelling in school and even going to university and having a career. We need to keep a keen eye on child development milestones, especially when it comes to social and language development. We are usually very alarmed when a child delays in walking. I get a lot of mothers coming to the hospital saying, oh, my child has not stood up. That time that child is 2 months. They are so concerned. Oh, my child is not standing. My child is not yet sitting. And the child is only 2 months. But when a child does not speak their first word, yeah, we don't take it so seriously. We are like, ataongea tu, akienda shule, ataongea tu, ama wacha tuende tuhamie mahali kuna watoto wengine, ataongea tu. Or when a child is not showing emotional and social adaptability, it doesn't concern us so much. So we need to be concerned about all milestones equally, and we need to be concerned and keep up with these milestones of our children, because the earlier we intervene with these children, the better their outcomes and the better their adaptability to society. Majority of children in the spectrum will benefit from speech therapy. As I said, just because a child can speak does not mean that that is adequate. They may need therapy perhaps to learn how to pronounce the words well, to learn how to put the right tone and how to put the right pitch. They may need therapy to increase the vocabulary that they have. They may also need therapy to learn about non-verbal communication. It's important to have a routine or a schedule and stick to it. Children in the spectrum do well when there is consistency, just like what Carol shared. They are very confused and they're very irritated when we keep jumping from one thing to another. You wake up today, you want to sing a song and pray. Tomorrow you wake up, you don't want to sing, you want to run to work. The next day you wake up, instead of singing and praying, you want us to go to the gym and run. The next day you wake up, you want us to eat breakfast. So that really confuses them and gives them a lot of emotional overwhelm, because they do not know, they can't predict what it is that, their life is supposed to be. So it's important to have a routine and stick to it every single day, even if it's Saturday and Sunday. For these children, there's no off day. If you wake up, then you sing, then you pray, then you eat breakfast, then you read a book, then you go outside, then you come and cook lunch. That has to be the same every day, whether it is Saturday, whether it is Sunday. There is no off day. If you say sleeping time is 7 o'clock, it is 7 o'clock every day, whether it is Saturday or Sunday. That gives them predictability, and that gives them a steady memory. And so they are able to adjust their lives better, and they're able to accommodate better, and you'll find them adapting to your family and adapting to life.
But if you are jumping from place to place, or we are eating, or we are singing, or we are dancing, or we are playing, you will have a very irritated child at the end of the day. Play therapy is also very beneficial for these children. Initially, it will be very hard because their safety net is by being by themselves, because they're not able to predict how those other children will treat them, whether they will be able to tolerate the different texture, the different sounds, the different behaviors of other children. But if you go with them to the play area, you supervise them, you show them how to play with other children, it becomes very, very beneficial for them. Because remember, just because a child is socially anxious or does not want to play with others, or is behaving like they don't want to play with others, does not mean they don't want that company or they don't want that social interaction. They want it, but they are very afraid of what can happen, or they're very afraid of how they themselves will react in that play situation, because sometimes they have not been given the skills to cope or to regulate their emotions. And they know if they go to a play area and they get upset and maybe they start hitting other children or they start hitting themselves, people will judge them and people will run away from them. So to prevent all that negative things from happening, they just say, let me play by myself. But if they're given the skills and the tools to play with other children, they enjoy playing. You'll find that they enjoy playing with other children. There's nobody who prefers to be by themselves. Everybody would love to be in company with other human beings because we are social creatures. But sometimes you find for children in the spectrum, because they're so afraid of what will happen if anything goes wrong when they're playing with others, they'll choose to be by themselves. So our role as parents, healthcare workers, and therapists is not to let them continue to be in their solitary environment, but to give them the skills that they require so that they can also participate in the other requirements of life, like social interactions. Some of these children may require special education, or if they go to a regular school, that regular school needs to have special accommodations for them. Maybe the teacher needs a teaching aid that will help this child understand. Let's say the teacher wants to teach 1 + 1 is 2. She cannot just say, oh, 1 + 1 is 2. And hope that this child maybe this child will require teaching aids like blocks. They may require the class to be done outside in the field so that they can understand. Maybe you're teaching about circles and radius and circumference. Don't just draw a circle on the blackboard and tell them, when you go around like this, you have done a circumference. No, go around in the field, draw a circle in the field, and let the children practically go around that circle so that they understand circumference. So they may need a very unique teaching style. It does not mean that they cannot go to a regular school. They can go to a regular school, but how does that regular school meet the specific needs of this particular child? So once the teachers who are trained on how to teach a child who requires to learn differently. So those accommodations need to be made for this particular child to excel. Maybe the room needs to be redesigned. We've seen that autistic people are triggered by either light or sound or textures or colors. So how is that room accommodated for this particular person? If this person is sensitive to light, maybe they need to be in a room that is darkened, that the light is not so bright, so that they are not triggered, because once they are triggered, they will have a meltdown and then teaching them will be difficult. Maybe this person may be easily distracted. Maybe this child is easily distracted by colors and pictures and sounds. So they may need a class that is a little bit softer, that has a little bit of soundproofness, so that they don't get all this sensory input, and then that may trigger them. How do we assist autistic children to transition into teenagehood and adulthood? As I mentioned, we give them so much support when they are younger. And then when they become teenagers, we say, oh, they don't need support. Now they are grown up. And they end up getting a lot of depression and a lot of mental illness because all the support they had when they were younger has been withdrawn. Now we leave them to make friends on their own. We leave them to look for jobs on their own. We leave them to go to the supermarket and the market on their own. And sometimes they need assistance, sometimes they need reminders, sometimes they need somebody to just basically keep them in check. So it's important to know that even as these autistic children are transitioning into teenagehood and adulthood, they still need some support, they still need some training, they still need some assistance. One thing we're also encouraging people to do, especially those who are not from very well-off homes. The other day I was doing disability assessment where I work, and I was very happy to see 2 autistic children being brought by their mothers for the registration with the disability program. Why is this important? Especially for those who come from financially challenged homes. This gives them some benefits when you're registered with persons living with disabilities, especially in Kenya. Other than the financial reprieve that they get, I think, is it 2,000 or 6,000 per month that helps with buying food or going to therapy, which I know is not enough. But when you're in the village, 2,000 can help a lot. When you're in Nairobi, 2,000 is nothing. But when you live in the village and you live in a farm that is now has not seen water for I don't know how many months, and both parents are not working, 2,000 to 6,000 can help. But other benefits include having that card. When you have that card of persons living with disabilities, and this child walks around with that card, when they are caught in a situation, maybe they have wandered, or they have gone exploring and now they are lost. Any person who comes into contact with this person will now know that this is a person who needs assistance. So they will not meet this child with violence or start arresting them and putting them in a police cell, because they will understand that perhaps the way this person behaves may be because of a disability that they live with. The other benefit they may get from being registered with persons living with disabilities is that they may get some affirmative action when it comes to looking for jobs. Currently, we have donors and these world organizations that are then you find that not all jobs are going to people who are able. We want to save some jobs for people living with disabilities. And when this child is registered with people living with disabilities, they will find that there are some jobs that they can easily get because they've already been registered. Because when we take these people to a job market to compete with people who don't have these challenges, it becomes very difficult. Let's say you are doing an interview. You are interviewing an autistic person, and you are also interviewing an autistic person for the same job. You may find that the autistic person may have even higher intelligence, but because the way you've structured the questions and the way you are expecting the answers to come may be different for the person with autism, the person with autism may end up losing that job opportunity simply because of the way they express themselves or the way they behave in a room. So it's important to have that protection, that you're a person living with a disability, so that you can get some assistance and some preferential treatment, even when it comes to the other requirements of life, like jobs and schools and other things, even like politics. There are some political seats and nominations that are reserved for persons living with disabilities. Next slide. Children with disability, with autism also benefit from behavior modification. And this is one challenge parents struggle with. How do we correct behavior in a child who is autistic? If I tell them, they don't understand or they don't remember. If I shout at them, they get irritated and then they have a meltdown. If I beat them, it does not seem to make any difference. So how do we correct their behavior? How do we modify their behavior when they make mistakes? And so there are other ways of correcting behavior, and there are other ways of instituting good behavior, even in children with autism. You can use positive reinforcement, and this basically means you reward them when they do something good. Most of us are from traditional African homes that only focused when we did bad things. When you did something bad, you were beaten, and so you remembered, or because of the fear and the pain that was instilled when you did something wrong, you learn how to avoid doing that wrong thing. But rarely would our parents praise us or say something when we've done something good. But this is actually a stronger way of instituting good behavior. By praising or rewarding children when they do something good, it gives them a deep memory and allows that behavior to keep repeated. When you have an autistic child, it's important to understand them, know their triggers, know what they enjoy and what they don't enjoy. And this allows you to accommodate the room or the surroundings to avoid them getting triggered. Because once they are triggered, it becomes very hard to bring them back. Once they start having a meltdown, it is very hard to bring them back to calm. So the best thing is to preempt, to know what triggers them and to avoid it. So if you know your child is triggered by many people, you will know, don't take them to a place that already has many people. Because if you take them like to a place with many people, they will get triggered, then they will have a meltdown, then you will try to remove them, it will be very difficult. You will try to feed them, it will be very difficult. You will try to maybe take them to the toilet, it will be very difficult. So once you understand the child, understand their needs and their routines and their requirements, then you fashion their lives, you design the life around them based on what they need and what triggers them. We try to discourage physical punishment or violence on children with autism, basically on all children, but specifically for children with autism, because they don't learn from physical punishment. Actually, when you punish them physically, when you beat them, you are teaching them how to be violent. So they will also go out there and they will beat other children, and they may even beat other big people, and then they may be beaten back and they may end up getting harmed. So we try to advise parents not to use physical punishment on children with autism. Find other ways of training their behavior and disciplining them. Avoid verbal abuse or neglect, especially in homes where autism has never been heard of or has never been seen. You'll find children with autism being called stupid or cursed or unwanted, or they're neglected, they're not given food, they're not allowed to go outside to play, they're not given toys, they're not treated like other children just because they are different. This leaves such a deep scar in them that will later give them depression or even other mental illnesses. So just because they are behaving differently does not mean they cannot hear when you call them stupid or unwanted. They will hear it and they will memorize it and they will keep it inside their heart, and it will continue haunting them for the rest of their life. So it's important to use positive words when we are addressing children in the spectrum. It is important to show them love. It's important to give them attention. It's important to give them the same benefits that we give all other children. When they behave in a manner that is unwanted, try and ignore it so long as it is not harming anybody. Let's say they are, they are going and bringing toys from the bedroom to the living room, which is something all children do. But maybe a typical child, you may tell them, don't bring the toys from the bedroom, play in the bedroom. And maybe a typical child will do that. But an autistic child will not. Maybe there's a reason they keep bringing those toys from the bedroom to the living room. So instead of always shouting at them and saying, why do you keep bringing these toys to the living room? And I keep saying playing in the bedroom. You should ignore such behavior because it is not harmful. It may be irritating to see toys in the living room, but it is not harmful. When you ignore it, they will somehow learn that this bringing of toys to the living room, it's not getting the attention that I want from mommy or daddy. So they will stop doing it because they're not getting that emotional feedback that they are seeking by bringing those toys to the living room. Then they will find another way of getting your attention. But when you keep shouting at them, yelling at them for bringing those toys, you are giving them the emotional feedback that they want from you. And then you could, as I said, redesign your house, redesign your class, redesign your therapy room or your doctor's room to make it comfortable for children in the spectrum. If maybe they're irritated by lights, make the room darker. If they're irritated by noise, make the room soundproof as much as possible. If they're irritated by colors, make the room black or gray, make it one color so that they're not irritated by the different colors. Basically redesign the life around these children. Next slide. So this is just an example of a simple chart that you can use to help autistic children or even other children to finish their meals. One of the challenges parents report with children in the spectrum is that they don't like to eat. And so you can make a chart like this. And maybe if they don't know how to read, maybe they have not yet learned the skill of reading, you can use pictures. And this big picture basically shows that when we are eating, we sit together as a family and we actually eat and we finish everything on the plate. And when they do it, you give them a star. You give them a star. And at the end of the week, you can agree if they have 5 stars or 10 stars, they get a reward. And the reward can be something they like. If they like cake, you can bake them a cake. And I'm glad Caroline talked about gluten-free cakes and healthier ways of preparing their meals. So you can agree that when the child gets 15 stars or 20 stars, they get a cake. Or if the child gets 20 stars, they go for swimming. Or if the child gets 20 stars, they do something that they love. And this will encourage that behavior of completing their meals. And this is very important for things like vegetables, because autistic children don't seem to like vegetables. They don't seem to like fruits. And so you can implement some of these charts to help them eat the foods that they don't like eating, but that are nutritious and important for them to eat. Next slide. Next slide. This is another chart. This is to teach them how to be kind and to teach them how to have social skills. You can see there that they get a star or a tick when they say good morning, when they say please, when they say thank you, when they help a family member, when they play gently with their friends, as opposed to playing roughly with their friends, when they share their toys, or when they smile at somebody. I want us to remember that it's important when you're addressing children, all children, not just children in the spectrum, to use positive language as opposed to negative language. An example, when a child is jumping up on the bed or on the chair, we usually just say, stop jumping on the bed. That is negative communication. Instead of saying stop jumping on the bed, give them the alternative, positive thing that they can do. So instead of saying stop jumping on the bed, tell them play on the floor or play on the carpet. So that gives a positive messaging and it gives them the solution of something that they can do. Instead of just telling them stop jumping, okay, now what can they do? So that's why this chart is designed with positive messaging as opposed to negative messaging. So instead of telling them, don't beat your friends, use positive messaging like play gently with your friends. Okay, next slide. I'm trying to move a bit quickly because time is going. This is another chart to help them to train to use a potty. This is a big challenge that most autistic parents will have, is how to potty train their children or how to wean their children from diapers. Majority of children in the spectrum will go on using diapers for a long time, but you can use other ways like putting pictures in the toilet to remind them of what to do when they're in the toilet, rewarding them for every small step they make towards toilet training. Like if they manage to drop down their pants, but they still peed on their pants, reward them because at least they did one step in dropping down their pants. Then the next time, maybe they'll go the next step of sitting on the potty. Even if they sit on it for just 1 minute, reward them. Then the next time they'll go to the next step. And it may take a while because this is one big challenge that autistic people have. And some of them in level 3 may go on to use diapers for a long period of time. But with patience, with repetition and consistency, majority of them will achieve independence in using the toilet. Next slide. The alternative therapies that are out there, and everything is different for every child. It does not mean that if one therapy worked for this child, it will work for all children in the spectrum. So you can try as much as you would like until you find what works for your child. There are some parents who have done hydrotherapy for their children and it has given them some sense of calmness and some sense of emotional regulation. And so the meltdowns and the tantrums have reduced. There are some who have tried music therapy. There are some who have tried hyperbaric oxygen therapy. There are some who have tried art therapy. There are some who have tried stem cell therapy. And there are some who have done a diet that's healthy, full of vegetables and fruits. There are some who've done gluten-free, like Carol. There are some who've done casein-free. Casein is a protein that we get from milk. So there are some who have eliminated that. There are some who have eliminated sugar. There are some who have eliminated all processed foods. There are some who have eliminated red dyes. And we cannot say you must do this for your child to live better. What we are saying is know what your child is either allergic to or irritated by and eliminate it. Because one of the things that makes them have hyperactivity or meltdowns is when they are frequently exposed to something that is harmful to them. And we don't know what this harmful thing could be. It could be something that they are eating. So once you know what it is for your specific child, just eliminate it. And sometimes you may not know, it may not be obvious. You may need to do a lot of trial and error until you find what works for your child. Next slide. This is just a picture of a man. I'm sure we all know this guy. This is Elon Musk. He has Asperger's, and Asperger's is a form of autism. And many people like saying, oh, autistic children cannot do this, cannot do that, will never go to university, will never have a job, will not do this, will not do this. But this is an example of a man who has excelled despite his diagnosis. He's very wealthy, one of the wealthiest men in the world. He has been married, he has had children, he has so many companies, and he's doing so much for the world. Of course, he's also a bit controversial, but the point I'm trying to make is there is no limitation to what an autistic child can do. They can break the ceilings, and they can do everything that any other person in this world can do. Next slide. So this is just a slide of what I offer as a doctor and as somebody who has done ABA. I have a certificate in ABA, so I offer online or physical home-based solutions, either when it comes to diagnosis, advice, linkages and referrals, behavior modification strategies that you can use with your child. I also work with some schools to try and improve the experience of autistic children in schools. Next slide. And these are the ways that you can reach me. I think we'll project this at the end so that if any parent wants to reach out to me, they can find me using those different channels that are available there. And then the last slide is about questions. And I'm seeing that we already have questions, so I will hand the meeting back to the moderator so that you can tell me how to answer some of the questions.
Okay, thank you very much, Dr. That is such an eye-opening presentation. I'm sure all our participants can agree to that. Thank you so much. Yes, now the questions are coming in. Now this is the time we are opening the floor to our participants to just ask those questions. And even as I start picking some of them, one is which types, that is question one, which activities should we give autistic learners to calm them and capture their attention? Kindly explain some examples that will help these learners settle. I'll take that again. Which activities should we give autistic learners to calm them and capture their attention? Kindly explain some examples that will help these learners settle.
Okay, so thank you for that question. So as I said, every child is different. There are some who will calm when you put music. There are some children, when you sing to them, they will calm down. There are some children, if you rub them a particular place and with a particular, there are these vibration things that vibrate. If you rub it along their hands and their shoulders, they will calm. There are some, if you give them a particular toy, maybe it's something they're fixated on, maybe it's that red track, they will calm down. There are some, if you dance with them or jump around with them, they will calm down. There are some, if you put them in a certain pillow, these big pillows that if you sit on, they like, what is it called? They sink and then they cover you. It calms them. There are some who, if you put them on a swing and you swing them around, it will calm them. There are some who, if you put, especially for the small ones, if you put them in a stroller and you just move the stroller around, that sense of movement and vibration might calm them down. There are some who love having the feeling of wind blowing across their faces. So if you like flap a paper and they feel that wind and the breeze on their faces, it will calm them down. So the point here is there's no one activity. You will have to know what calms your child down and have that ready anytime in case they get triggered. It could be a vibration, it could be a massage, it could be a song, it could be a toy, it could be the feeling of wind or breeze, it could be some movement, it could be some comforting blanket or a comforting material. So find out what works for your child and use that.
Okay, thank you, Daktari. We have question number 2. What are the solutions to tantrums thrown by autistic learners? And then what causes epilepsy in autistic learners, and how should you manage this situation in a classroom setup?
So for hyperactivity is not all autistic people will have hyperactivity. There are some autistic children who have both autism and they also have ADHD. And so they may have hyperactivity also as another diagnosis. Or some children have autism and they have been triggered by something, and because they have been triggered, they stand up and move. So sometimes we misinterpret that to mean that this child is hyperactive, but maybe they're just responding because they have been triggered. So the thing that works with hyperactivity is behavior modification strategies. So reduce the distractions, and you can reduce distractions by making your room one color, maybe a gray color, so that they're not easily distracted. Don't put too many things on the wall because that will distract them. And once they're distracted, they will stand up and want to walk or want to do something else. Don't make the room too noisy, and don't give them too many activities to do. So don't tell them color, when you color, finish, and write. When you finish color, writing, go there and put some blocks. Just give them one simple activity so that they're not distracted. Some teachers also put the ADHD or the hyperactive children closer to them. So like if the teacher is sitting in front of the class, the ADHD children should be at the front so that they can easily see the teacher, and the teacher can easily remind them what they're supposed to be doing so that they can stay on task. So those are some of the things the accommodations we can do in class to help hyperactive children to stay on task. Also give them short activities with the frequent breaks. Don't keep them seated for 30 minutes. Do something for 10 minutes, allow them to stand up and stretch or walk around, then come back, do another 10 minutes, let them stand, stretch, walk, and then come back and do 10 minutes. So give them frequent breaks so that they can release some of the extra energy they have. It's also helpful for hyperactive children to be engaged in a physically strenuous activity. So like if they can have a trampoline that they go and jump on every few hours so that they can get rid of some of the energy. If they can ride a bike, if they can go swimming, those physically strenuous activity helps them with their focus and helps them to get rid of too much energy.
Okay, thank you, Daktari. There's other question that was asked, what causes epilepsy in autistic learners?
Yeah, so
the situation in a classroom setup.
As I mentioned, some children have other diagnoses on top of their autism. So autism on its own does not cause epilepsy, but you find some children have autism, but they also have epilepsy. Epilepsy is now another disease, but it's possible to have both diseases at the same time. So the causes of epilepsy are many. It could be genetic, it could be hydrocephalus, maybe they have excess water in their brain. It could be because of hormonal disturbances or nutritional disturbances. It could be because of, cerebral palsy, which is another diagnosis. So autism on its own does not cause epilepsy, but it's possible to have a child who has both autism and epilepsy. And so the management for that is first to find the cause and then treat it. And majority of them will be put on anticonvulsants, which are medications that stop convulsions. But if it's something that like hydrocephalus, the water may need to be drained
so that the conversion.
Okay. Is it only our side? Daktari, we have lost you. Can the rest of us hear Daktari?
No, we lost him.
Okay. Daktari, we have lost you. Okay, we are getting in touch with her. Meanwhile, as we do, it is now 12:03 and the questions are many. So so that we give you the opportunity to get the questions answered, please bear with us. And if you have to leave, we'll understand. But if you can just hold on a little bit for your question to be answered, we'll appreciate. We'll extend just for your sake. I hope that's okay with us as we get to Daktari.
Sorry, are we going to receive the recording, please?
Yes, you will. It will be on our YouTube page after an hour or so after the meeting.
All right, thank you.
Yes. Okay. Let's see. We are getting in touch with Daktari. We're just waiting for her. In the meantime, there are a few things that Daktari spoke about, especially speech therapy for our caregivers at home. There are some strategies. Oh, okay, Daktari is back. Daktari, let me first hold on to that, then Daktari goes on. Karibu, Daktari. Please unmute.
Thank you.
So, Daktari, we lost you when you are concluding the last part of the answer.
Okay. What we were talking about epilepsy.
Yes.
Yeah, I was saying that epilepsy on its own has its own causes. I mentioned that it can be cerebral palsy. It can be because of hydrocephalus, which is a buildup of water in the brain. It can be because of a genetic issue. It can be because of hormonal or nutritional imbalances. So when you're treating epilepsy, you have to find the cause and then remove the cause. But majority of them may require anticonvulsants, which are medications that stop the convulsions.
Okay. Thank you, Daktari. I want to take a question from Mr. Owen Orinda, who has raised his hand. Please ask your question, sir.
Daktari, I must confess that Daktari must be a very bright Kenyan, and I want to believe that she can take Kenya forward. My name is Owen Orinda. I'm an education officer, but I'm a quality assurance and standards officer at the headquarters in charge of education for the blind and deafblind. I want to thank Daktari for giving that very good talk on autism. And we have also realized that autism is one area that has been troubling our teachers in classes. Gray areas Daktari has highlighted, and I believe that if teachers are here, then they've been benefited greatly. The much have also benefited. My first question is, apart from hereditary causes, and now the next causes of autism is not known. Then another question is that we have structures for intervening on educational interventions for our learners with disabilities and including learners with autism. One of the structure is for education assessment and resource centers. I'm not very sure how Daktari works with our education assessment and resource centers in placing our learners with autism to schools. I'm happy that Daktari alluded to the fact that there are solutions, and one of the solutions is making sure that our learners are given reasonable accommodations when they're in classes by teachers. So currently, we are also talking about the interventions that are done in schools. After the referral, after you have placed your learners to school, which strategies do you actually talk to the teachers about? And are your services also accessible to our public schools? Because majority of our learners with autism are in public schools. My last question is on the rise of the cases of autism in Kenya currently, we have realized that quite a number of learners are being diagnosed with autism, and sometimes intervention strategies are failing. Could there be a reason why we are seeing the upsurge, or is it just because of the awareness of autism that we are saying that currently autistic learners are more? Lastly, I want to congratulate Dr. too for alluding to the fact that CBC has come to save us, because we are doing both curriculum that can be followed by learners who do not have disabilities, and the learners who have severe disabilities who can be taught by doing quite a number of curriculum areas, and that these two curricula are actually now accommodating all types of learners. We have adapted curriculum for even learners with autism who can follow the regular curriculum with adaptations or with the accommodation. Then we have a clear curriculum for learners with severe disabilities. Could be a learner with autism and probably intellectual disability too. So those are some of the benefits that CBC is bringing in. As much as we all know, we have a little bit of some challenges, but CBC is here with us to stay, and we are really struggling to make sure that all learners are accommodated. Thank you again, Daktari, and may God bless you for the good insights. Thank you.
Thank you, Owen, for the kind words. How I work with schools, I work in both public and private sector. I'm employed by Kiambu County in one of their hospitals. So how I work with schools, I give pro bono capacity building seminars for teachers. So I work with the education officer. So I work in Gatondo North right now. So I will work with the respective education officer in Gatondo North, and we will have a seminar, especially for ECD teachers. And we just give them skills on how to spot that child who is delaying and how to spot that child who requires extra assistance in class. Then we even write letters when these children come to my clinic at the hospital, and I ask how is the education experience for this child, especially for children with ADHD, cerebral palsy, a cerebral palsy child who may be in a regular school, an autistic child who may be in a regular school, and any disease basically that causes intellectual disabilities. So we write letters to the teachers for how this learning style and how the students can be accommodated within the regular class. For example, you may find a child who has ADHD who keeps standing up in class. So the teacher has given up on this particular student and allowed the child to just wander and leave the class unsupervised. And so we write letters, official letters, to tell this teacher that this is a child who has ADHD. These are some of the challenges they have. This is what you can do. Like, give them shorter tasks, allow them to have breaks in between. And when they stand up, don't interpret it as rudeness and start beating them or sending them out of class. So you'll find some of these ADHD kids are just being left to go play in the field, and they are missing out on a lot of learning that their peers are going through, just because the teacher perhaps does not understand that this is a disease that keeps them standing up every 5 minutes or so in class. Then we also get a lot of referrals from teachers from public schools. Sometimes it's the teacher who spots that this child requires assistance even before the mother has spotted, because the teacher spends a lot of time with this child. And so sometimes we get notes and referrals from teachers saying, please assess this child. Do they have a learning disability? Do they require extra accommodation? So they come with a referral from the teacher, we do an assessment, and then we give feedback on the learning of this particular child. Then we also offer advice to parents who have children who have learning disabilities on whether this is a child who will go to a regular school with accommodations, or should this parent seek the services of a special school or a special intervention. I don't know if I've answered all the questions that Owen asked.
About the upsurge of autistic cases in Kenya.
Upsurge of autism. Yes, it is true that we are getting more and more diagnosis of children with autism. And there are several reasons for this. Number one could be that the awareness is getting better. More and more doctors, more and more healthcare workers are being trained on how to diagnose autism and how to spot autism. So we are getting better at diagnosing autism. Remember, majority of the children who have autism in a few years back were not diagnosed. People would just say, he has a mental illness, but we don't know what it is. Or he has a learning disability, but we don't know what it is. But now that more and more of us are being trained on how to diagnose, how to spot it, how to notice it, more and more people are being diagnosed. The second reason could be because of the environment. We are now, as we are becoming more and more modern and more, how do I say, civilized, in quotation marks, we are abandoning some of our behaviors and adopting new ones. For example, nowadays, for parents or families that live in Nairobi in the flats, you'll find parents and families isolating themselves. We don't want children to go outside and play because they will get dirty, they will interact with people whose behaviors and cultures we don't agree with. So we lock ourselves in our houses and give our children gadgets and give our children TV all day in a bid to avoid whatever it is we are avoiding out there. And so these children end up growing with lack of social skills. They end up growing with lack of verbal skills because those gadgets do not talk to the children. The children just end up consuming whatever the gadget is offering. So there is a type of autism that's called institutional autism, and it's seen with such kind of children who are locked up and isolated from society and may not have somebody interacting with them to talk back to them, to give them social cues. So they end up developing lack of communication and social or behavioral regulation strategies, and they may end up presenting as autism. But for this type of autism, it's actually reversible once this child is exposed to social activities, to other people, and to environments that are stimulating for the social and their emotional lives. The other thing I think that may be causing more autism could be perhaps the fact that we are I don't know how to say, intermarrying very closely. You know, Kitambo, in African culture, before you marry somebody, there was an investigation that was done to make sure that this person is not your relative, this person does not come from the same clan as yours. There were a lot of investigations, even though they didn't have the scientific background. You would find spies are sent to that village that you want to marry from to find out, does that family have some diseases? Do they have some behaviors? So that, to try and minimize some of these, genes from intermarrying and, now expressing the disease in the generation to come. But nowadays, when we live in the city, you just meet a boy or a girl, you just love each other, you fall in love, and the next thing you are living together, the next thing you are reproducing children. And there was no intensive background research to find out, okay, what are the genetic illnesses in this side of the family, and what are the genetic illnesses in my side of the family, and when we mix our blood, will they produce certain illnesses? So I think these are some of the things that have come with modernization and urbanization, that we don't do a background check, and so you end up you have reproduced with somebody, perhaps you had the gene from your side of the family, but it was not manifesting because it was weak. Then you marry somebody who also had the gene, but was not manifesting. But because now those genes have combined, now we have a child who has the illness. So some of these things that, because we are not doing proper background checks, we are not doing proper investigation. None of us did a genetic test before we reproduced our children with the partner that we have. So I think that could also bring about the increase in the number of not just autism, but a lot of these inherited diseases that we are now seeing more and more in our children. So those are some of my thoughts on the issue of increase in number of autistic cases.
Okay, thank you, Daktari. I believe, Mr. Owen, the question has been sufficiently answered.
Thank you. I'm happy Daktari has answered me sufficiently.
Okay. Thank you, Daktari. We have more questions. Please bear with us, and then we'll take maybe, is 5 more okay, or are you okay with me taking all of them? What do you have me do, Daktari?
We can do maybe 2 or 3 more.
All right. So in no specific order. In most kindergarten schools, the classes are always full of displays. Can this trigger meltdowns?
Yes, it can. Yes, it can. If this is a child, if you have a child who is triggered by colors, pictures, distracting thoughts, it can trigger a meltdown. And unfortunately, these children will just be branded as rude or unteachable or, mtoto tu kichwa ngumu. But maybe this is a child who has been triggered by the environment. So it's important for teachers. I'm not saying don't put displays, but once you notice that a child is triggered by displays, maybe this is a child who needs to learn in a different class or in a different environment. You can maybe lump these children together who are triggered by displays and put them in another room that does not have so many displays.
Okay. The last question here, let me just read it out for you. During occupational therapy, is it okay to force them, that is the children, to do something they're not interested? For example, they want to stack up toys, but the therapist insists on flashcards. Then the child becomes grumpy and angry. Is it okay to force activities on them?
It's never okay to force anything in anybody, not just in autistic people. Maybe what I would advise the therapist, maybe it's important, maybe the therapist wants that child to learn something through the flashcards. Maybe what I would advise him is to use the stacking up of toys as a positive reinforcer for the flashcards. Since the child has already demonstrated that they prefer to stack up toys, but the therapist wants the child to learn something through these flashcards, maybe the therapist can tell the child, okay, if we do flashcards for 2 minutes and you grasp something for 2 minutes, then you can have the toys and you stack up for maybe another 5 minutes, so that the child can both learn what the therapist wants the child to learn and also get to enjoy stacking up the toys for a period of time. So that, use that, the fact that the child has shown you the stacking is enjoyable to teach them whatever you want them to learn through the flashcards. So use it as a positive reinforcer.
Thank you, Daktari. Now, as you have ably guided me, Daktari has allowed for 2, and that is where we stop. However, we will pick your questions. We will send them to her via email, and we should be able to respond to you. I hope for those whose questions have not been answered, just drop your email address. We should be able to get to you with your answer when we finally get, Daktari needs a break. It's been a long process today, and we are
Thank
really
you.
grateful. Yeah, so we are coming to the end of our webinar today. We want to thank every last one of you for staying with us, starting with us, joining us, staying till the end. We are glad that you've been enlightened. We will post this recording on our YouTube page. We will also share with you our contacts in the various emails. We'll do a follow-up email to you. And now I just want to give just a recap of what we have learned today just from Daktari. Remember to exercise patience, repetition, and consistency in what you're doing, and you will get the results. I've just taken a few of sound bites, if I may call them that, from the presentation. Again, I would like to finish with something called I Can. I call it an I Can slogan. When the world says that the children with autism in this case can't, as a caregiver, choose to see and say, but they can. As Daktari has told us, they can. When the world says they will struggle, choose to see and think of their strengths and empower that. And when the world says that this will be ugly, the autism journey, choose to see and also say it can also be beautiful. And as a caregiver, you've got what it takes. I've been your moderator for the day. My name is Caroline Wadege from Gifted Gems. We will continue doing autism series. This is just the first throughout the year. So we'll continue calling out you to come and learn together with us as we bring in different professionals on different aspects related to autism. So at this juncture, thank you very much. And I want to invite my colleague Lillian to close for us with a word of prayer. God bless you all.
Thank you, Caroline. Thank you, everybody, for coming. Let us pray. Gracious Father, thank you for making this day successful. As we depart, Lord, we ask you to be with us. May your angels go with us as we continue with our daily course. Thank you for the lives that you have prepared beforehand for us to touch with the lessons learned today. Thank you for the wonderful time that we've shared. May all glory and honor come back to you in everything that we do. It is in Jesus' name we pray and believe. Amen.
Amen. Thank you.
Amen.
So thank you to everyone. We'll be putting up Daktari's contacts and our contacts as well. God bless.